Pre-participation physicals are important for youth athletes because they're designed to catch potentially dangerous conditions that may adversely affect people when they're becoming physically active. So the whole point behind these is to catch something before it manifests into something that's a little bit bigger and potentially dangerous for your daughter or son. Our bodies change a lot as we move on from being an infant to a toddler to an adolescent and then on to adulthood. So we want to make sure we're monitoring those changes, and having a pre-participation physical exam is going to put you in front of a doctor each year, and that allows them to look for any abnormal changes, and also allows your daughter or son to actually converse with their doctor and talk about what's happening with their body and understand the changes that they're going through so that they're more aware of what is normal and what isn't normal. And that's something that we should all be teaching our kids, is understand how your body normally feels. If something doesn't feel normal, they should let somebody know, and they should talk to somebody about that. With regard to new policies and procedures with pre-participation physical exams, some organizations have decided to extend the physical requirement not just every year, but every other year. And a lot of that depends on what your local regulations are. And that's something that you're going to have to look up depending on where you live. As we come out of the pandemic caused by coronavirus, the idea of getting a physical may be a little worrisome for some parents. We may feel like it's unsafe to go to the doctor's office because we don't want to be around sick people. You have to understand that doctors are following stringent cleaning procedures and making sure that precautions are taken in between each patient throughout the day. So they're trying to ensure that your visit to their office is a safe one, and a safe visit to the office could lead to a safer participation in athletic events. But again, the rules and regulation where you're from are going to dictate whether you have to get it yearly or if that extension was taking place. And you should absolutely check with your local schools or sports organizations to find out their most current recommendations. If your organization is not requiring a physical for this year and you decide not to go with one, there are some things that I would pay attention to if your child's reporting certain things to you that, say, you know what, I don't care what the recommendation is, I'm still going to get them into the doctor's office to make sure they get checked out because they experienced something like this. And again, this goes to having your child know what normal feels like and telling you if they feel abnormal. Some things I would be a little concerned about, or that would cause alarm with me, would be anyone that was experiencing dizziness, anyone that was experiencing lightheadedness, chest pain, shortness of breath, double vision while they were participating in some kind of physical activity. If your child passed out or was diagnosed with a concussion, that's something I'd always want to go. Maybe they weren't even diagnosed with a concussion. Maybe they just hit their head, but later they told you, oh, I don't feel so good, my stomach kind of hurts, I feel a little nauseous. Maybe their personality changed a little bit after they hit their head. Those would be things that absolutely want to make sure a physician's checking out, because there could be some underlying damage that we can't see with a head injury. If your child suffered an injury during the last sports season that caused them to miss time, that's usually a good idea to have them go to a physician and check out to make sure that tissue has healed appropriately. If they've had a surgery, obviously you want to make sure that surgery is healed appropriately, but maybe they just missed a couple days because they sprained an ankle. We want to make sure that ankle is all ready for them as they move forward. So that would absolutely be something I check out also. If you're not going to get checked out, you may still want to fill out a medical history form and maybe talk to your athletic trainer or healthcare provider at your organization and see if they see any red flags that they might want to go in. Even though it's not a full-on real pre-participation physical exam, you're still communicating with someone in the healthcare field, and you're still getting your concerns addressed. And if they need to go further and you need to actually get referred in to go see somebody, that's a time and place where you can stop it right then and there and move forward and say, okay, well, let's go get this taken care of. Athletic trainers are the ideal healthcare professionals for physically active populations. Athletic trainers are skilled in the recognition, treatment, and rehabilitation of injuries and illnesses related to physical activity. Hopefully, an athletic trainer is available to your daughters and sons as they get back into sports so that they can have their progress monitored as they're going on. Coming off this pandemic, we have to understand that your child is going to be a little bit detrained, which basically means their bodies have regressed. A lot of times with athletics, we're always thinking progress, but unfortunately, when you take a lot of time off, your body gets used to hanging out in the house. And this is a time where we especially need to be cognizant of what feels normal inside our bodies. and we need to be very cognizant of the demands that we're placing on our athletes. Now, kids may come back a little bit quicker than adults. If I started playing right now, it probably wouldn't go so well. But the younger kids will bounce back a little bit. It is something we need to monitor and watch. And athletic trainers, our job is to monitor and watch athletes to make sure they're participating in as safe a manner as possible. Aside from the physical portion that athletic trainers are looking at, athletic trainers are around your children every day. And one thing we do is we learn what your kids are like. And the same way I tell you to have your kids know what normal feels like, I have to know what normal is for your kid. As an athletic trainer, I pay attention to what my kids are acting like and different body language and all of those other different various factors that could tell me that something's going on in that child's background that maybe we need to be aware of. Maybe we need to have a discussion with the parent. So I'm always looking at my athletes and saying, are you acting normal? Is this your normal attitude, your normal demeanor? Because when I see changes in that, that's when I need to start asking questions as a healthcare provider, because again, health isn't just physical, it's the physical, the mental, and the emotional. So we are cognizant of that as we're sitting on the sidelines. If your organization does not have an athletic trainer, this would be a time to start asking questions of, who's the healthcare provider that's watching my child on the sidelines? Because that's information I, as a parent, want to know. And that's information that we need to make sure is being addressed with the overall administration of the sport that your child is playing.